Malaria versus typhoid. Know the difference. Malaria versus typhoid explained. Symptoms, causes, treatment and prevention. Have you ever had a fever, body weakness, or severe headache and immediately assumed it was malaria? Or perhaps someone told you, it must be typhoid. In many parts of the world, especially in tropical regions, these two illnesses are often confused. But here's the truth. Malaria and typhoid are completely different diseases, caused by different organisms, spread in different ways, and treated with entirely different medications. Mistaking one for the other can delay proper treatment and, in some cases, lead to serious complications. So how can you tell the difference? What symptoms should you watch for? And when should you seek medical attention? Stay with me, because by the end of this video, you'll know exactly how to recognize malaria and typhoid, understand their key differences, and learn how to protect yourself and your family. Before we begin, please like this video, subscribe to the channel, and turn on notifications so you never miss important health updates. What is malaria? Malaria is a potentially serious disease caused by a parasite called Plasmodium. It is transmitted to humans through the bite of an infected female Anopheles mosquito. Once inside the body, the parasite first travels to the liver, where it multiplies. It then enters the bloodstream and attacks red blood cells. This destruction of red blood cells is what causes many of malaria's classic symptoms. Common symptoms of malaria: high fever that may come and go, chills and shivering, sweating, headache, body aches and joint pain, fatigue or weakness, nausea and vomiting, loss of appetite. In severe cases, malaria can lead to confusion, difficulty breathing, severe anemia, seizures, kidney failure, coma. Malaria can become life-threatening if not treated promptly. What is typhoid fever? Typhoid fever is a bacterial infection caused by Salmonella typhi. Unlike malaria, typhoid is not spread by mosquitoes. It spreads through contaminated food and water, especially in areas with poor sanitation and inadequate access to clean drinking water. Once ingested, the bacteria enter the intestines, then the bloodstream, where they spread throughout the body. Common symptoms of typhoid fever: persistent high fever, weakness and fatigue, abdominal pain, headache, loss of appetite, constipation or diarrhea, dry cough, body aches. Some people may also develop a coated tongue, rose-colored spots on the chest or abdomen, abdominal swelling. If left untreated, typhoid can cause intestinal bleeding or perforation, which is a medical emergency. Why people confuse them? Malaria and typhoid share several symptoms, including fever, headache, weakness, loss of appetite, general body discomfort. This overlap often leads people to self-diagnose incorrectly. Many assume every fever is malaria. Others believe persistent fever automatically means typhoid. In reality, fever can result from many conditions, including viral infections, urinary tract infections, pneumonia, and more. That's why proper testing is essential. Key differences: malaria versus typhoid. 1. Cause: malaria, caused by a parasite. Typhoid, caused by bacteria. 2. Transmission: malaria, spread by mosquito bites. Typhoid, spread through contaminated food or water. 3. Fever pattern: malaria, fever may come in cycles, often with chills and sweating. Typhoid, fever tends to rise gradually and remain persistent. 4. Digestive symptoms: malaria, nausea and vomiting are common, but abdominal symptoms are usually mild. Typhoid, abdominal pain, diarrhea, or constipation are more prominent. 5. Chills and sweating: very common in malaria, less common in typhoid. 6. Rash: rare in malaria. Rose spots may occur in typhoid. 7. Laboratory diagnosis: malaria, blood smear or rapid diagnostic test. Typhoid, blood culture is the gold standard. Other tests may be used. Can you have both at the same time? Yes, it is possible, although not extremely common. A person living in an area where both diseases are prevalent may contract both simultaneously. This can make diagnosis more challenging because symptoms overlap significantly. That is why healthcare providers often investigate carefully before prescribing treatment. How each condition is diagnosed. Diagnosing malaria. Rapid diagnostic test, RDT. Microscopic examination of blood smear. Diagnosing typhoid. Blood culture, most accurate. Stool or urine culture in some cases. Other blood tests may support diagnosis, but cultures are preferred. Avoid relying solely on symptoms. Self-treatment without proper diagnosis can be dangerous. Treatment options. Malaria treatment. Malaria is treated with antimalarial medications. The exact drug depends on the type of malaria parasite, severity of illness, local drug resistance patterns. Early treatment usually leads to complete recovery. Typhoid treatment. Typhoid is treated with antibiotics. It is crucial to complete the full course, even if symptoms improve early. Supportive care for both conditions includes adequate hydration, rest, fever management, proper nutrition. Never take antibiotics for malaria, and never take antimalarial drugs for typhoid unless prescribed. Prevention. Preventing malaria. Sleep under insecticide-treated bed nets. Use mosquito repellents. Wear long-sleeved clothing at night. Remove standing water around your home. Ensure windows and doors are screened. Preventing typhoid. Drink clean, safe water. Wash hands regularly with soap. Eat well-cooked food. Wash fruits and vegetables thoroughly. Avoid food from unhygienic sources. Consider typhoid vaccination if recommended. Prevention is always better than cure. Malaria and typhoid may look similar at first, but they are very different diseases. Remember, malaria is caused by a parasite spread by mosquitoes. Typhoid is caused by bacteria spread through contaminated food and water. Accurate diagnosis is essential for proper treatment. If you or someone you know develops persistent fever, don't guess, get tested. Early diagnosis saves lives. If you found this video helpful, please give it a thumbs up. Share it with friends and family. And subscribe for more trusted health information. Comment below, have you ever mistaken malaria for typhoid, or vice versa? I'd love to hear your experience. Stay healthy, stay informed, and I'll see you in the next video. Like this video if you learned something new. Subscribe for weekly health education videos. Share this with someone who often says, "It's just malaria." Comment your questions below.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.